Hi, everyone, and thanks for joining. We're going to take a few more minutes to allow folks to come on before we start our program. All right, seems like it's about that time. Thank you everyone for joining us online today. My name is Cara Watkins and I am the campaign manager of the Funding Our Future campaign, a coalition of organizations dedicated to making long-term financial security and retirement a possibility for all Americans. To learn more about the campaign, you can visit fundingourfuture.us. We appreciate you tuning in today for a conversation about Social Security's finances and the impact that COVID-19 has had on the program. Yesterday, the Social Security Board of Trustees released its 2020 annual report on the financial status of the Retirement and Disabilities Trust Funds. But the content of the report was developed prior to the economic fallout from coronavirus, which is just starting to come into focus. Today's projections will be seriously tested as the labor market's reel, raising questions such as how might a decline in payroll tax revenues or a rise in disability benefit claims affect the finances of Social Security's trust funds. We're joined today by a handful of experts who are going to help us break down the most important takeaways of the Trustees Report and what factors we should be considering as the pandemic and its economic consequences become clear. Before we get started, I'd like to take a moment on behalf of Funding Our Future to acknowledge our partners. We have more than 40 partner organizations, including our executive partners, Edelman Financial Engines and the Charles Schwab Foundation. Two of our partners, the Committee for a Responsible Federal Budget and the Center on Budget and Policy Priorities, are participating in today's program. Finally, we are excited to host this webinar in partnership with the Bipartisan Policy Center, which has a new analysis out yesterday showing the potential impact on Social Security's trust funds from the economic recession we are entering. I would encourage you to go to bipartisanpolicy.org and take a look. BPC would also like to thank the Peter G. Peterson Foundation for their generous support of this work. Now, let's move on to today's programming. I would like to note that at any time during the webinar, you can ask one of our panelists a question using the Q&A function in Zoom or tweet at us with @BPC_bipartisan and #BPC Live. We'll be taking these audience questions later in the hour. We are honored to be joined today by Steve Goss, who serves as the Chief Actuary of the Social Security Administration. He has been in this role for nearly 20 years, and there are few people more knowledgeable about the financial challenges facing this program. I'm going to pass it over now to Kathleen Romig, Senior Policy Analyst at the Center on Budget and Policy Priorities, to get us started with the first discussion.
Wonderful, thank you, Cara. So Steve, I was wondering if you could just start by giving us maybe a 5-minute summary of what is in this year's Trustees Report and why the Trustees Report should matter to Americans.
Thank you very much, Kathleen. Really happy to do so. Yeah, whoever's got control of the slides could just flip to slide number 2 here. Just want to sort of indicate, first of all, in terms of why Social Security is important to the American people, at the end of 2019, Social Security was providing monthly benefits to 64 million people. That's 1 in 6 Americans. 54 million were for old age and survivors insurance benefits, and 10 million were for disability beneficiaries and their dependents. Now, we had 178 million people during the year of 2019 who had earnings that were covered under Social Security and were paying in payroll taxes. During that year, the good news is that our OESI and DI trust fund reserves combined actually rose by $2.5 billion, which is $1.5 billion more than had been expected. Now, on slide number 3, just a quick item here of the legislative mandate for doing these annual trustees reports. They've come out every single year starting 1941. The Congress requires that we provide a few different things. One is what happened in the last year, just mentioned, what the expectations are for the next 5 years, and the so-called actuarial status of the program. The extent to which there are shortfalls projected gives Congress an indication of how big a job they're going to have before them to make sure that the benefits will be provided to people on a timely basis and in full in the future. So on slide number 4, we have a quick indication here of, first, as Katie mentioned at the beginning, or I think Kara mentioned at the very beginning, that in fact, the trustees report, due to the timing of the start of the pandemic and the time at which we had to really develop assumptions for this report, trying to meet its statutory due date of April 1 or as close thereafter as possible, the report does not include the potential effects of the pandemic. So what did happen in this report? What did happen in this report is the good news that, in fact, the DI reserve depletion date was advanced 13 years into the future, based largely on the really historically low applications and incidence rates, numbers of new people coming out of the disability rolls, all the way through 2019. The trustees decided to have a somewhat lower ultimate incidence rate for the disability program going forward into the long term, and a gradual increase in the incidence rate rising up to the ultimate level, which is substantially above where we are at this moment. Now, the OASI, Old Age and Survivors Insurance Trust Fund, reserve depletion date is projected still to be at 2034 as last year, and the combined reserve depletion date for OASI and DI trust funds put together, which is an important perspective, is also the same 2035, although I would say earlier in the year 2035. Again, none of this is with putting in any potential effects from the pandemic. So on slide number 5, you can see a little picture we love to sort of put forth, which really speaks to quote unquote solvency of the program. Because remember, solvency is at any point in time, is there enough money in the trust funds to be able to pay the scheduled benefits at that time in full. And you can see as long as these curves for the trust fund ratios, which are the amount of reserves we have as a percentage of the annual cost of the program, as long as those are above 0, we're in good shape. You can see how things changed from the 2019 to the 2020 trustees report. The DI fund is the one that really got a lot better. You can see the OESI and the combined funds are 2034, 2035 is the place that we're looking like we're going to be having to have action by Congress by that time. Now on slide number 6, you can see sort of like what the annual run is. This is a useful slide because you can see the blue line, which is actually the cost of providing benefits in full as scheduled in law. And you can see how that rises between 2008 and 2035 and then stays at a sort of a displaced level higher than that. You'll see that line turns into a dashed line after 2035, indicating that that would be the cost of providing full benefits, which under current law could not be done. We would have to drop down to providing only the level of expenditures that are indicated on the solid blue line, because the trust funds do not have the ability to borrow like many other entities. And so if the trust funds are short of money, then that's all that can be paid is what's available based on continuing revenue coming in. On slide 7, you can see what we like to refer to as sort of the sustainability of the program. And the point on this is you can see that we shift from about 4.5% of GDP that we'd had up through about 2008, 2010, shifting to a higher level of about or maybe slightly below 6% of GDP. So this is just an indication of sort of the amount of the overall economy that is necessary to sort of finance the OESI and DI costs. And we're going to have a shift from 4.5 up to 6% of GDP. And that is something that we will have to deal with as a society, and the Congress will be the ones to sort of deal with that. Now, keeping in mind what that curve looks like on the next slide, number 8, this sort of answers the question of why we have that shift up between 2008 and 2035. It's simply because of the changing age distribution of our population. The black line shows the ratio of 65 and over folks to working age 20 to 64 folks, and you can see how that shifts up exactly as the cost rate relative to GDP or payroll does as we move from 2008 to 2035. And if you wonder, well, why is there that sudden jump? Look at the blue and red lines, which indicate that had birth rates stayed at 3 children per woman, or what had been the case during the baby boom period, 3.3 on average, you can see that this age of dependency ratio would not be rising at all. It would be rising, well, it would be rising a little bit just because we're living longer and expect to be living longer in the future. So the big jump, the level shift on this, which is really creating the financial challenge for Social Security, is really because of the changing birth rate that we had after 1965. And it's remained at the relatively lower level ever since then. So this is really what we're going to have to deal with in the future. Now, real quickly, just to give you a little picture on the next slide of what's going on with disability for Social Security, you can see since the peak in the Great Recession on disability, we've had a massive drop in disability incidence rates, now down, and these are applications. The drop in applications has dropped down to remarkably low levels in 2018 and 2019. We're projecting that they will be going back up, not quite as high as we projected in the last year's Trustees Report. With any luck, they will stay down at levels like we've seen recently, but out of an abundance of caution, we're still assuming they'll go up somewhat in the future to levels that are fairly close to what they've been historically long-term average. Now, on the next slide, you can see something that's really more directly attuned to what the cost of the program is. We call this the disability incidence rate. This is the number of people newly being awarded disability benefits as a percentage of those that are insured and not already getting a benefit. And you can see historically, this is averaged about 5.1 to 5.2 per thousand. We're now projecting that the ultimate will be at about a 5.0 level, while on the other hand, you can see in the most recent experience, we've been on closer to 4.0. So we're assuming there will be a 25% increase ultimately in the disability incidence rate moving into the long-term future relative to what we've had recently. Time will tell if that is being too pessimistic or what. So on slide 11, this is just gives a real quick little breakdown of what some of the moving parts are for this year's Trustees Report that made things look better or worse. You can see the few black items are things that made things a little bit better. That is, in fact, well, better in terms of the financing of Social Security. Death rates, in fact, turned out to be higher in 2019 through 2019 than we have been projecting. That is actually positive for the system, even though that's not the news we most like to hear. The disability incidence rates, as already indicated, have stayed lower and are assumed to be lower in the future. That's a positive. Several other items, like, for example, the trustees are now assuming a slightly lower ultimate total fertility rate, down from 2.0 to 1.95. And some other items like interest rates, real interest rates, the inflation rate are all assumed to be somewhat lower. But one of the most important things, of course, was the enactment of the rescission of the employer-sponsored group health insurance premium excise tax that was in the Affordable Care Act. That excise tax was expected to be lowering the level of and the growth in employer-sponsored group health insurance coverage and therefore premiums. Remember that employer-sponsored group health insurance premiums are not subject to the payroll tax, wages are. So with a rescission, we're now expecting to have higher and more growth in employer-sponsored group health insurance premiums, which will slow, therefore, and lower somewhat the level of wages relative to employee compensation in the future. And that, of course, is somewhat of a negative for the system, but that was a legislative change. So with that, let me pass the baton back to Kathleen. I hope I didn't too much run over time.
Thanks, Steve. So this year, as many others, when we see headlines about the Trustees Report, they often use words like bankrupt or going broke. And it causes a lot of workers to worry that Social Security is going to disappear altogether, especially before they get to collect the benefits that they've been earning and paying into. So could you tell us what you would say to one of those worried workers?
Well, thank you very much, Kathleen. That's such a great question. We hear all the time words like Social Security will run out of money, or Social Security will become bankrupt, as you said, or even just that the trust funds will become exhausted. Not really sure exactly what exhausted looks like or what that means. But the reality is that we're projecting now, say for the combined funds early in 2035, that we would reach the point where on a combined fund basis, our reserves would become, we say, depleted. However, we would still have regular tax revenue coming in under the projection equal to 79% of the cost of providing the full schedule of benefits at a timely basis. Now, 79 cents on a dollar is not all that we would want, but it's a long way from not being able to pay any benefits at all. The real key on this, though, is that Congress well understands this, always had over the whole 85-year history of the program. And any point in the past, if you look in the history, where we reach the point where trust fund reserves appear to be approaching rapidly depletion, the Congress has always acted it in a timely fashion to avert a sudden drop-off in benefits. So people, in the American public, hopefully they would rest assured that the future will be much like the past in that regard. Their elected representatives are looking out for them.
And before we move on, I just wanted to ask you one question about what coronavirus or COVID-19 is, what you think it will do to Social Security's financing and also to the benefits of retirees who are retiring in the next couple of years as average wages are plummeting.
Well, that's really the, dare we say, the $64 billion question, updating from many years ago, the way we would phrase that. We have looked at this a little bit, obviously, and at this point, things are so incredibly uncertain about the depth and the duration of what the pandemic is going to be doing, both in a health perspective and with respect to the economy. Just as a simple little example, I might offer one thing that we actually offered at a little press conference after the Trustees Report came out. If, as appears to be the case, we have, say, for the entirety of calendar year 2020, which we are now in, say, a reduction in employment earnings and payroll taxes on the order of 15% for the entire year. Now, that would mean after the inception of the first sort of, locking down of the economy, we would be probably on the order of having 20% less revenue for 3/4 of the year, resulting in, for the year as a whole, having 15% less. We're, of course, optimistic and hopeful it won't be that bad. If that were to be the case and we had a reduction in payroll tax revenue for the balance of the year at 20%, so 15% for the year as a whole, what that would do, it would change our trust fund reserve depletion date for the combined OESI and DI trust funds from early 2035 to about the middle of 2034. It'd cost us a little bit over 1/2 of the year in the reserve depletion date. Now that, of course, is assuming that we would not have some extremely extended period of effect or dramatic effects on numbers of beneficiaries. And I would say that to this point, perhaps not surprisingly, we have not seen an upsurge in retirement or disability claims to the program. We believe that's at least in part because of the extended unemployment insurance. We tend not to see increases in benefit claims when unemployment insurance is available. If a recession extends for a long period of time and extended unemployment wanes, then we would start to see an increase. Just to add a little bit to this, I would say that if it turns out that it's not just this year, if we have 2 years of really large effect and say have a 15% reduction from expectation in tax revenue to the trust funds for this year and another 15% next year, we would expect that all else equal would tend to make the trust fund reserve depletion date move then to probably about late in or maybe the middle of 2033. So we're looking at probably, unless this is a really, really extended period with really deep permanent reductions, we're expecting that we might have 1 to 2 years earlier reserve depletion date for the OSDI trust funds. But of course, all bets are off and we will just have to see what happens. We just really don't know whether we're going to be back to normal at the end of this year, the end of next year, or when. And I'm hoping maybe the remaining panelists on this will actually be able to give us their great insight into that thought.
Wonderful. Well, thank you. I'm going to turn it over to Mark Goldwine from the Committee for Responsible Federal Budget to move us on to our next panel. Thank you so much, Steve.
Okay, great.
Well, thank you, Kathleen and Stephen. Thank you, everyone, for being here today to talk about this important, I think, very timely report. We're lucky to have with us 2 of the nation's top experts on Social Security. I mean, 3, including Steve, but 2 that I'm going to introduce, Bob Reischauer and Chuck Blauhaus. Bob and Chuck were both former trustees of the Social Security program. They both served on the Bipartisan Policy Center's Commission on Retirement Security and Personal Savings. Bob was former director of CBO and former president of the Urban Institute. Chuck is currently at Mercatus and was previously the deputy director for the National Economic Council. They both have much longer resumes, but rather than waste time talking about that, feel free to Google them. Let me open up by asking Chuck a question, which is that in many ways, this report has shown deterioration relative to last year, and you've expressed concern and reason that folks should be concerned about Social Security's financial state. Can you talk a bit more about that?
Well, sure. I think that's an important starting point. I know everyone is very curious about what is going to be the effect of the ongoing economic slowdown on Social Security's finances. But in order to really get a sense of that, we have to understand where we are coming into the crisis. And the 2020 Trustees Report, while it doesn't show us what's going to happen under the current economic slowdown, it gives us very valuable information about where we sit right now, and what is the starting point from which any of this, the effects of the economic slowdown will be operating on. There was one figure that was mentioned in Steve's presentation that I really think sums it up very well. We're looking at an actuarial shortfall over the long range of 3.21% of taxable earnings going forward. Now, 3.21% probably sounds like a really small number. But it's actually not a small number in this context, because it's actually about 19% of scheduled benefits over the long term. Or put another way, in order to close that shortfall, we would have to raise the current 12.4% payroll tax all the way up to 15.54% starting next year. And it's actually, it's even more severe than that, really, because if you think about what changes are likely to be realistic, we're not going to implement a sudden change in tax rates or a sudden reduction in benefit levels like that. We're certainly not going to cut benefits, at least Congress hasn't done so historically, for people who have been on the rolls for some time. If you look at the size of the shortfall measured as a percentage of future benefit claims starting next year, it's about 23%. And again, if you start looking at the practical space for action, we're not going to reduce benefits 23% next year, even if there weren't a crisis ongoing. Any changes that we do make would likely start out very gradual. Maybe the first cohort that's affected gets affected somewhere around 1%. But what that means is that if you affect people less in the short term, then ultimately the changes in the long term have to be much larger. And so the facts and figures surrounding the size of the current shortfall are very important to understand. And it's also important to appreciate that sort of the practical constraints upon legislative action show that the problem is becoming very severe very quickly. There is a tendency, I think it's a regrettable tendency in press coverage of the trustees' reports to focus on the dates of depletion. And the dates of depletion are certainly important in the technical sense, but they're not really the thing of most importance from the perspective of when we need to act. That's really determined by how large is the problem and how soon do we have to act in order to be able to close the shortfall at a point where it can still be closed. Additional point I would make is that this is a concerning report even before the virus crisis hit. Over the last year, we saw a worsening of about 15% in the 75-year shortfall. That's pretty substantial by the historical standards of the trustees' report. In fact, that's the third largest worsening from one year's report to the next that we've seen in the last several years, since 1983. So that's a very substantial worsening in the outlook, even before we take into account the fact that things are probably going to get significantly worse as a result of this year's economic problems. So we're definitely in a boat already where we're going to have to do pretty much everything if we want to get this system fixed. We're going to have to change eligibility ages. We're going to have to moderate the rate of benefit growth. We're probably going to need some additional tax revenues. We're not going to have enough from any one of those pots by themselves in order to close the shortfall. We're going to need bipartisan action. We're going to need compromise. We're going to need a multiplicity of solutions to be on the table. And that's even before taking into account the worsening that's going to occur as a result of this year's economic slowdown.
Thanks, Chuck. And before I move on to Bob, I just want to remind folks, if you do have any questions for Chuck or for Bob or Steve, to please submit them through the Zoom Q&A function, or alternatively, if you're on Twitter, you can tweet at BPC_bipartisan, or with the hashtag BPC Live to ask us the questions. Bob, Chuck talked about how this report has sort of deteriorated relative to last year's, but as we know, it doesn't account for any of the effects of the coronavirus and the subsequent economic effects. Steve mentioned that if there was just a one-time blip in wages, we could lose a year of insolvency. But of course, what we're also seeing is changes in interest rates and changes in employment that could be long-lasting. What do you expect to change once we incorporate the economic effects of the current pandemic, and what are the risks to the program?
Thank you, Mark. Let me just start way at the beginning here. and say that everyone knows that the financial viability of Social Security depends critically on the strength of the US economy. We also know that the economic outlook for the US and in fact for the world as a whole has changed dramatically since the trustees' economic assumptions were locked up to produce the 2020 Trustees Report. As late as January of this year, there was little reason to question the strength in the short run or in the long run of our economy. In fact, we were feeling pretty good about the longest expansion in American history. And the assumptions that the trustees chose to underlay the 2020 report were reasonable. They reflected the consensus of forecasts of mainstream economists. But then suddenly, as a result of COVID-19, we find ourselves in a very sharp economic contraction and one that could have a significant impact on Social Security's finances, particularly on the income side, which depends critically on payroll tax revenue, which in turn depend on employment, which has fallen through the floor. But there's also the effect on the interest earnings of the trust fund reserves and also the income coming from the taxation of Social Security benefits, as well as some possible change as a result of the economy in the numbers of people applying for retirement benefits early and DI rolls as well. The extent to which the current economic contraction will affect the financial strength of Social Security will depend on how deep and how prolonged the recession is and how long it takes to get back on a path that we assumed it was on before, or how much that path changes in the future. Now, no one knows the answer to these questions with any degree of confidence, and you shouldn't really hold your breath waiting for answers, because we probably won't have a credible understanding of where the economy is or where it's going for another 6 months to a year. And it will depend critically on developments in the medical area and on the psychology of the American people, having gone through an experience that no one has ever gone through before, which is being locked at home. Is it going to lead, when this is over, to a great surge in vacation seeking because people haven't, or will people be scared for the next 4 or 5 years to get on a cruise ship? And we just don't know. There are reasons to be optimistic and to think that while the contraction might be very sharp and deep, it won't be very long. And the main reasons for having this view would be that the economy was basically quite healthy before the COVID-19 problem and had none of the structural problems that characterized the economy before the Great Recession, 2007 and 2009. In addition, a reason to be optimistic is that the government has provided an unprecedented volume of countercyclical fiscal and monetary policy, somewhere between 2 and 4 times what it unleashed on the economy back over a decade ago. But there are reasons to be pessimistic and to feel that this could be both deep and very long slog ahead of us. It's worldwide to an extent that the previous sharp recessions weren't. The suddenness of the shutdown leaves a whole lot more wreckage that's more difficult to claw your way out of than has been true in the past. And as I said before, many people believe that we won't be out of this until we've developed a vaccine, or else some very effective ways of mitigating the pain and suffering and death that come from this virus, that we have to really regain the confidence of the consumer. Now, given this uncertainty, the Bipartisan Policy Center, specifically Shai Akabas and Nico Goldstone, have generated some illustrative estimates of the possible impacts of the economic contraction of various sizes on the health of the trust funds. And these are just, in a sense, another view relative to what Steve has already offered. What they've tried to do is answer the question of what if the current downturn had an impact in magnitude on the trust funds that was similar to that of the Great Recession, the 2007 to 2009 recession, or recessions that were several times as large or considerably smaller and shorter. Steve has provided some insight into that, which I think is very valuable and is different from the preliminary estimates that the Bipartisan Policy Center has produced. And those ones suggest that the depletion of the trust funds could be advanced anywhere by 6 or 9 years, up to 9 years sooner than projected in the Trustees Report, which is, we have therefore a huge range here reflecting really the uncertainty, but this is to give you a feel for what is possible. I want to just reiterate one point that Chuck has made many times in the past, and that is that we focus way too much emphasis on when the depletion dates of the trust fund are, and less on what will it take to get Social Security's finances back on a long run viable pattern. And so the question that might be more important to ask is, what will this downturn that we're in now do to the long run assumptions of the trustees in the future? What effect will it have on potential economic growth, on demographic assumptions for the future? And that will be, of course, played out over the next few years.
Thanks very much. And I recommend everybody check out the Bipartisan Policy Center analysis. Just to explain the numbers a bit more, they actually project the old age program, assuming a Great Recession size disruption, will deplete its reserves by 2029 as opposed to 2035, 6 years. And the disability program, instead of 2065, will be 2024. So a 40-year advancement of that insolvency. I mean, the economy giveth, the economy taketh away, especially on the disability side, where the disability rates and the revenue really matter. Both of you, I think, were trustees for 5 or 6 reports. I don't know if I have that exactly right, but Chuck, you noticed that there were some major presentational changes in this year's trustees report. Do you want to talk about those for a couple of minutes?
Yes, actually, first of all, that gives me an opportunity, so thank you for it, to talk about the necessity of getting public trustees confirmed. It's something that obviously we've been talking about for some time, Bob and I know the Bipartisan Policy Center has been working as well to support the effort to get public trustees confirmed. There have been 2 highly qualified public trustees nominated, Jim Lockhart and Bill Douster. They're more than capable of plunging right into this work. This has been important for a long time, but I think it's especially important over the upcoming year because the trustees are going to have to make very substantial changes between this year's report and next year's report, reflecting the effects of the virus and the economic slowdown. We really want to be in a position where the public has confidence in the projections that have been made. And so it's critical to have public trustees in there overseeing that process. But in terms of this year's report, there were some very interesting changes. The summary of the report led this year for the first time with a very nice capsule summary of the changes in the outlook between last year's report and this year's report. Now, normally, as a former public trustee, I'm always nervous if there are significant presentational changes made in the absence of public trustees to really give their blessing to those changes. But I thought these were excellent presentational changes. They certainly helped me as a reader better understand the change in the outlook from last year's report to this one. So I thought the presentational changes were very, very good. I think in general, the trustees have been very cautious in the absence of public trustees with changing the look of the report. But there were some very useful changes this year that I think will help readers to understand just how the picture has evolved over the last year.
Mark, just let me add my praise to that of Chuck's. I think the presentational changes were really helpful for the public and the understanding of the program.
Great. Now, the same time that the Social Security Trustees Report, the very same trustees also released the Medicare Trustees Report. And I know this is mainly about Social Security, but Bob, could you talk for a minute or two about what the Medicare trustees found and maybe how that could be affected by the COVID crisis?
Well, while there's a lot of uncertainty surrounding the impact of the COVID crisis on Social Security, there really has to be even more uncertainty with respect to Medicare, because we really don't have a firm grip right now on what the COVID crisis is going to do to Medicare expenditures. On the one hand, you have a virus that is affecting old people disproportionately, and many of them are being given very complex and expensive procedures. On the other hand, there's been a huge fall off in people going to the doctor for elective surgery, for just regular visits that they would otherwise have gotten. And so we really don't know, is this going to be a big plus in Medicare expenditures or a big minus? And where's that plus or minus going to occur? Is it going to occur uniformly in the hospital insurance program and the Part B supplementary medical insurance programs, or heavily in one and an opposite signed effect in the other? Of course, Medicare HI depends critically on payroll taxes, and that trust fund is expected to be depleted by 2026, and that number has not changed in this year's report versus previous year's reports. And of course, from a financial viability standpoint, the Part B and Part D SMI programs have no problem, because under the legislation that governs those programs, the payments are met by premiums paid by individual participants and by general funds, so that they can't become depleted, so to speak.
Thanks very much. And I can just tell you, we've started to look at the dailies on hospital insurance costs, Medicare Part A, and they actually went way down in March because hospitals, I guess, started canceling appointments and procedures, and then they have spiked dramatically in the month of April. We're talking 3, 4 to 5 times in normal in some days. I want to have one last question before we turn it over to the audience. Again, folks can ask questions by Zoom. And I want to ask both of you this question, so maybe 30-second response each. But we're in the midst of what's clearly a public health and economic crisis. What do you say to people that say now's not the time to be worried about Social Security and Medicare? And what is the right time to worry if it's not now? Maybe Chuck can answer first, and then Bob.
Well, I'll start by saying I agree. I mean, we have to deal first and foremost with the public health crisis, right? That's a higher priority than everything else. We've got to stabilize the economy. We aren't really in a position right now to take a long-term view of a lot of things. We don't even know what our situation is going to be a year from now. So I certainly agree with the sentiment. It's not useful to say it, but it's a reminder that this is why you need to fix programs like Social Security and Medicare before crises hit. Because when crises hit, you're in a position where you can't pivot and immediately deal with them. But I will say that we're going to come out of this crisis in a sharply accelerated predicament with respect to Social Security and Medicare. So we shouldn't dither once we are through the worst of it And we have to start dealing with Social Security and Medicare finances as soon as possible after that.
Thank you.
Well,
Bob?
I agree with Chuck's basic point. Your question was, well, if now isn't the time, when is? And the answer is 10 years ago, 15 years ago, but we don't really have that option. And what you have to weigh here is not anything more than we have to keep the American people's faith in this program and its viability front and center. And so a lot depends on whether Steve's projections or suggestive projections are going to be the ones that we discover are closer to the truth, or whether this is upon us even sooner. But if it looks like it's coming much sooner, we want to maintain the confidence of the American people that our political system can respond in a credible way.
Thank you. So before we turn over to audience questions, I want to go back to Steve Goss for a minute and see if he has any thoughts or comments based on our former trustees' answers.
Thank you very much, Mark. And thanks Chuck and Bob for perspective. And this is really good. One thing I just would really want to comment on is that both Bob and Chuck did indicate that we shouldn't just focus on reserve depletion dates. That is absolutely true. But please do pay attention to the fact that the new trustees for 2020, admittedly not reflecting the COVID pandemic, does indicate that at the point of reserve depletion, the projection now is for 79% of benefits to be payable in 2035 versus last year's report, 80%. A little bit lower, but nothing dramatically different. Similarly, for the year 2094, the end of the 75-year period, that percentage drops from 94% to 93%. Curly, no, I'm sorry, that's from 74% down to 73%. Again, a little bit of a diminished perspective from last year. I would just mention also, Chuck mentioned the increase in the actuarial balance or the reduction in the actuarial balance to more negative. It is true, it was pretty large this year. A lot of that was the excise tax, remember, which is a congressional change. Another item which is very significant in that, please keep in mind, that particular metric of the so-called actuarial balance is the interest rate that is utilized. And this year's the interest rate, real interest rate, was lowered. What that does is it makes the more distant year shortfalls larger in terms of this summary number for the actuarial balance. But remember, that will also make look smaller in the same context changes that might be made to the program in the future. So really a change in the interest rate for assistance financed on essentially pay-as-you-go basis really doesn't matter much in terms of what Congress will have to do. So please just keep all that in mind. The one other thing I just want to comment on is Bob and Chuck both mentioned, especially Bob, the idea of it's about the economy. People use other words after that sometimes, but it really is about the economy. And the real question here is, obviously, we are in a big hit. We had another unemployment read this morning. The question is, how long will this really last and what will be the sustained effects? We know that in the last recession, the trustees, we did put forth, we assumed permanent level shift down by 2 or 3% in the long-term future for the level of potential GDP as a result of what happened in the last recession. So a big part of the question about this recession, COVID-induced, is it going to be a level shift down forever and ever? Or is this going to be something temporary that we bounce back from? Mm-hmm. If I might, finally, one item I mentioned before, 1 or 2 years possibility, if we had a 15% drop off in employment earnings and payroll taxes coming in. I did take a real quick look at what the BPC material had last night, and I would just offer that the indication of an OESI reserve depletion date being pulled as early as late 2028. My little quick calculation of that would indicate that it would be not 2 years of a 15% drop off in revenue, but it would be 8 years of a 15% drop off in revenue, which over the 9 full years after the start of the Great Recession, that would be 30% more of a drop off in revenue than we actually had in the Great Recession. So Shah, we're gonna have to talk more about what's going on there. But the question really is, as Bob and Chuck indicated, it's all about a matter of how long will this last and how will we come back? If in fact, as Bob indicated, perhaps on the optimistic side, this is a year or two for not phenomenon, and we and the rest of the world basically come back from that, I think the BPC projections are probably a little bit far out in terms of that. But if in fact this turns out to be really a long-term and fundamental shift down in the level of economic output and productivity, then we are talking about a different story. So I would just entreat everybody to sort of think in terms of there's a dramatic range of possibilities, anywhere from by the end of this year we come back, in which case we've got a half year earlier reserve depletion with no effect at all on the percentage of benefits that would be payable in the out years, all the way to something that could be much more dire.
Steve, just a quick question. Does that half year we come back account for the lower interest rates that we paid on the trust fund reserves in the interim?
Absolutely, it does.
Okay.
Yeah.
Thanks.
Because
So
what I
I'm
was
gonna-
looking at is the effect on what would happen for the total income of the program, which would be lower interest rates in that period of time too.
So I'm going to turn over to audience questions, and since there are a lot of very similar ones, I'm going to try to consolidate a little bit so we can get as many as possible. There are a few questions about international comparisons, and both asking broadly, how do other countries fund their Social Security and public pension systems? And then what are one or two countries that have solved for the demographic challenges, and how have they done so in ways that the US can learn from? Maybe Chuck, you can go first because I see you inching forward.
I'm happy to take a brief crack at that. I'll begin by just saying I'm by no means an expert. I'm certainly not current in the international systems. However, I will say that many systems internationally have gone through different phases of dealing with this. And unfortunately, many of them have done what we're doing, which is sort of waiting a little bit too long and then having to make changes later in the game that are much more aggressive and severe than they otherwise would probably have preferred to make. And they could have been in a better position if they had started making them earlier, but it's the nature of the beast that political systems don't always respond as rapidly as they should. But there have been a number of systems that have gradually altered the rate of benefit growth in their pension systems. Sometimes, like right now, our initial benefit formulas are pegged to the growth in the average wage index. There are some systems that their benefits grow according to growth in prices, and there are some that have hybrid systems where they grow somewhere in between price inflation and wage inflation. And what has often happened is that sometimes systems start out with a more aggressive rate of growth and they find that doesn't work, and then they keep re-indexing to slower rates of growth later on. There have been some international systems where they have put in something that we might want to consider, which is automatic stabilizers, so that there are automatic adjustments to things like eligibility ages and the growth of the benefit formula as there are changes in the ratio of workers to collectors. Steve made a point that I'm very grateful that he made because it's so important, which is that demographics drive so much. Our immediate cost surge, as Steve indicated, is driven primarily by fertility trends, but there's also a component over the long term that is driven by increasing longevity. And countries that have automatic adjustments in place to deal with changes in the workers to collectors that arise from these factors sometimes put their systems in a way where they can automatically respond without their legislatures having to take an additional vote to stabilize the program. So these are all tools that different countries have used abroad.
And can I just jump in here too? I'm also not a student of international pension systems necessarily, but I think it's really important to note that the United States is a low tax country compared to peer nations for our pension system and just across the board. And we are going to need more revenue again across the board and for Social Security, and that's something that other countries have also employed successfully.
Yeah, Mark, if I could just add, and I don't want to get ahead of Bob here, but we have obviously looked at what other countries have been doing here. Many of the European countries, and especially Asian countries, are suffering much bigger challenges in terms of their changing age distribution because of even larger drops in birth rates. I'm pretty sure I'm recalling right that I believe Germany has, for the equivalent of our Social Security system, a payroll tax rate not of 12.4, but of more like 25%. So one option obviously is to simply charge a higher payroll tax rate. Chuck was obviously not enamored with that, and I don't think any of us would be who wants to pay more taxes. The other option is to do a little bit of like what was done in the 1983 amendments. As Chuck indicated, increasing longevity. We should probably expect to have some further increases in the so-called normal retirement age under Social Security, which if we would index that, as we have many proposals out there looking at, that could solve all by itself probably on the order of maybe about a third of our shortfall. But keep in mind, indexing the retirement age is unlikely to fix the whole shortfall, because the shortfall is not just because of longevity. In fact, it's actually a small factor. So there are lots of possibilities on this. And it really, this is, I guess, what we come down to always is, what will our Congress representing the American people want? Will they be willing to go from 4.5% of GDP up to 6% of GDP allocated to be able to finance the program as it is now, constructed with scheduled benefits, or will they want to pare back the benefits at least to some extent? And that's really the choice before
Yes,
us.
I'm going to jump off of that comment to ask another question. If Bob, you want to use this to answer more about international, since you didn't get to, feel free. But what current, this is a few people have asked versions of this, what current plans are actually out there? What are politicians in particular and our leaders proposing to restore solvency or otherwise improve or modify Social Security? Maybe Bob gets first go, since he didn't answer.
Well, I'm probably not the right person. Steve has been doing, and his office has been doing excellent estimates of these proposals, and by and large, they are proposals that have many elements to them. They're sort of, as one would expect, modifications of the existing system on the benefit side and on the revenue raising side. A little weak on the latter compared to the former, but they are often mixtures of improvements in benefits for certain groups and then attempts to offset the cost associated with that with a variety of reductions. Steve?
Well, yeah, I guess I'd just offer one thing that, you're right, Bob. One thing that I know that Chuck and Bob and I have looked at really hard, Kathleen and Mark too, is that we know that since about 1980, the last time Congress actually enacted a desired level for our taxable maximum amount up to which you pay your 12.4%, we've had sort of a changing distribution of earnings levels across our society. And rather than having 90% of all wages, of all earnings falling below our taxable maximum, we're down around 83% now. Many people have suggested, well, why don't we get back to what Congress intended back then? As Chuck indicated, we've been wage indexing that taxable maximum level, but that's fallen short of keeping 90% of all earnings falling into the tax base for Social Security. So if we would raise the taxable maximum enough to get back to 90%, that, similar to indexing retirement age, each one would actually eliminate somewhere on the order of 30% or so of our shortfall. So those are two ready possibilities. One other thing I would just mention, there's a group, I think they're called the Bipartisan Policy Center, that had a nice little proposal put together by a number of members of Congress at the time. It wasn't really, I don't think it was voted thumbs up by all the members, and it wasn't adopted. But back in 2010, they had an item on that. And one thing that was kind of intriguing that we thought would perhaps allay some of the concerns about raising the normal retirement age was a provision that they had put in to say that people with lower income, with lower lifetime income, would not receive the full or maybe not any of the increase in the normal retirement age or even the earliest eligibility age. So there are many, many ways that this can be approached to try to sort of mitigate the shortfalls.
Yeah, I think you actually are referring to the Simpson-Bowles proposal for 2010. But that's okay. I just wrote it. No big deal.
I jump in,
Chuck, would you mind jumping in?
Yeah, no, I'd like to jump in because, Steve, you're absolutely right that I wasn't enamored of the illustrative immediate payroll tax rate increase that I cited in my remarks. But by way of illustration, immediately moving the payroll tax rate from 12.5% to 15.5% next year. Definitely not enamored of that. But I do want to be clear that I'm in firm agreement with both you and Kathleen that the likelihood of doing a solution without any additional tax revenues at all is negligible. It's very difficult for me to see how any sort of bipartisan agreement could be constructed that didn't have some new revenues in there. So I totally agree with that. I want to be clear about that. I also think it's very, very unlikely we could get it all done the other way. We wouldn't be able to do it entirely with tax increases. There's going to have to be some moderation in the growth of outlays. We're going to have to meet somewhere in the middle. Another bipartisan policy center plan that was put together is one of the commission that Bob and I served on. That was almost exactly split 50-50 between cost constraints and tax increases. I personally might have preferred one more on the cost constraint side, but the 50-50 blend was a roughly representative increase of where the members of that commission were. Final thing I would say is just the last thing we should do is make the problem worse by having anything that does an across the board increase in our overall obligations of the program. Unfortunately, we've seen some proposals to do that. I think in the current financial environment for the program, that would be profoundly irresponsible, and we need to make sure we don't go down that road.
Okay, I think I can consolidate to two more questions, but you'll have to promise to answer them quickly. The first is there's a couple folks asking about if demographics is the problem, how much can demographics be the solution, either through changes in immigration or changes in birth rates? And if so, what should we do? Keeping in mind that there are probably children watching this.
I mean, my answer to that question would be policies to affect demographics are controversial and likely to have extremely small impacts on the long run financial future of Social Security. Not that demographics won't, but policies trying to affect demographics.
Yeah, that's the literature on pronatalist policies in other countries definitely indicates that you just don't see a big effect. And it's, as a working mother, I would say I wouldn't particularly like the government putting its thumb on the scale about my fertility. So I agree with you there. On immigration, I think it's different. I think, obviously it's been a very politically controversial issue, but I think there's a lot that we can do on the immigration side. And Steve has shown that in some of his really powerful graphs.
We also have to recognize the fact that we're simply not adjusting to the demographic realities that we're faced with, right? I mean, we have a very different ratio of workers to collectors than we had in past decades. And yet on average, we are collecting Social Security earlier than we were when the program was first established. And that's obviously a big stressor for the program. You have to think in terms of the three big variables are what's the tax rate we all have to put in, what's the annual benefits the program can provide per capita, and how many years of life do we expect the program to be able to do that? And if that last variable is not dealt with in a realistic way, it continues to put more and more pressure on and creating a more unfavorable relationship between the amount of taxes we have to put in and the annual income security the program can provide.
So Mark, if I could just add, first of all, that there have been, I think Sweden was an example back maybe 20 years ago when they did some things about providing, I don't know if it was healthcare, but providing time off and even paid time off for mother and father when they had kids. And we've certainly seen a lot of proposals to perhaps enhance childcare availability, and that would probably have some effect. But pulling us back up from the roughly 2.0 total fertility rate back up to 3 or 3.3 is certainly not going to happen as a result of that. Any movement up in the total fertility rate would be a little bit of a plus. Immigration would certainly be a plus also. There's no question about that.
Thanks. And last question, and again, I'm combining a few, but so far Congress has enacted what will be the equivalent of about $2.5 trillion of spending increases and tax cuts to address the current crisis. What would happen to the financial state of the program if they had instead put that money into Social Security? And why shouldn't they, or should they consider a significant general revenue infusion?
Oh, that question's right in my wheelhouse. Can I go first on that one?
Yes.
I think I would just say this. Social Security and Medicare, certainly Medicare hospital insurance. I mean, by design, it's not designed to be a general revenue financed program. And we could make the policy choice to abandon that, right? I mean, that's certainly a choice we could make. We don't have to have a program that's financed the way that it is. And whether we want a Social Security program that's financed as it has been historically is a value judgment we can make. However, before we get rid of it, and before we start shifting to a general revenue finance program, we have to remember that a lot of Social Security's unique character and unique political strength comes from the way that it's financed. It's not designed as a welfare program. It's not designed as a program financed from the general fund, funded by people's income taxes. There's a perception that workers, at least in the aggregate, have financed their own Social Security benefits with the contributions they've made from their earnings over the years. If we abandon that, we're basically undoing the thing that has caused Social Security to be in a privileged political position relative to welfare programs over the years. With the welfare programs, we're much more willing to change eligibility rules on a moment's notice, change benefit levels on a moment's notice. We don't do that with Social Security, and we don't do it because of the way the program is financed. So yes, we can get rid of the current financing mechanism. We could have a program that's financed from the general fund or subsidized from the general fund. But once we do that, we get rid of this principle that Social Security benefits have been earned by the people receiving them rather than being paid for by other people's income taxes. And a lot of the political strength the program has enjoyed over the years is going to be dissipated.
Yeah, and I don't think it's an all or nothing proposition. I think it's possible to have some general revenue infusion over the longer term without giving up that earned benefit status that Social Security has. And in fact, the other social insurance programs we have are not entirely self-financed through payroll tax revenues. I mean, or Social Security 100%. Like Medicare, unemployment insurance, they have significant general revenue support. And I don't think that it necessarily, ruins Social Security's political attractiveness if you have some general revenues in the mix.
Well, just to reply, I think that's just one of the things where your panelists are going to differ. I think it's very difficult to be a little bit pregnant on self-financing with Social Security, because if you're going to finance part of it with income taxes, there's no reason the amount that it's financed from general revenues is going to stay stable. And also, yes, we have, say, part of Medicare is funded with general revenues, but you have to remember that part of Medicare is subject to income relating and means testing in a sense, in a way that Social Security is not. So yes, we could go to that sort of system, but it's going to change the political dynamics around Social Security, I think, pretty significantly.
Stephen, Bob, do you want to weigh in? And also to this more narrower question, if we were to put 2.5 trillion into the trust fund, how much of the 75-year solvency gap would that close?
Was that for Bob?
That's for you, Steve.
Oh, okay.
Your trust fund.
Okay, so first of all,
you're the actuary.
Let me just respond to the discussion between Chuck and Kathleen. Two gentlemen that I knew well, a couple of Bobs, Bob Ball and Bob Myers, who didn't agree on everything. They absolutely agreed on the ultimate importance of the political viability of this program going forward, that it be seen as an earned right, at least to a large extent. There is a small exception from the 83 amendments that I'm sure everybody here well recalls, that the revenue derived from taxing about roughly half of our beneficiaries' benefits with income tax. That money is remitted back to the OESI-DI and hospital insurance trust funds. So there's a little bit of that there that is going on. But that said, back to your specific point, Mark, I guess I would offer, and I really can't wait to hear Bob Reischauer's thoughts on this, the $2.5 trillion right now, if that had been put into the Social Security trust funds, it would not have had anything of the stimulative effects that were desired here. Yeah. It would be irrelevant, because Social Security is not at risk of not paying full benefits anytime soon. So it's obvious that money had to be done in a different form, and it would have been, I hope everybody would agree, inappropriate to put it into Social Security at this moment in time. We need more fundamental, longer term fixes, as all have been discussing here.
In terms of my back of the envelope, and then Bob, I want to let you close out, but my back of the envelope is it would cover about 13% or so of the long-term shortfall. Bob, if you want to close out, and then we'll kick back to Kara.
No, I really have not much to add. I agree with Chuck and Steve, actually, and I think, were we to have said, let's put a whole bunch of money into the Social Security Trust Fund rather than what we have done to try and combat the economic downturn, the impact wouldn't have been significant. Unless what we were going to say is we're going to forgive $2.5 trillion worth of payroll taxes. And that's sort of a different way of distributing the benefit than how we chose to do it. But it would be a way of distributing it to those who still had their jobs, as opposed to the grants that Treasury has been sending out to individuals employed or not employed and children.
Mark, could I just add one other little thing in the most recent legislation about some payroll tax deferrals, much like the legislation that occurred back similar in 2010, 11, and 12, any of the payroll tax deferrals or reductions that have been provided recently are all done in such a way that they are transparent to the revenues coming to the Social Security trust funds.
Mhm.
Social Security trust funds are not being diminished in any way by virtue of any payroll tax deferrals. Certainly they will be diminished ultimately by the reduction in employment, but not by the enacted payroll tax deferrals.
In other words, some businesses are allowed to pay their payroll tax, 2020 payroll taxes in 2021 or 2022, and a smaller segment get them partially forgiven, but all of that is, all the loss to Social Security is reimbursed from the general fund.
Right. Or maybe another way of putting it is that Social Security will be receiving those revenues as though that had not been enacted in real time, even during this period. And so it's effectively a loan being made by the Treasury to those employers for the current payment of the taxes.
All right. Well, I want to thank all our panelists, but I want to quickly turn it back to Kara Watkins at Funding Our Future to close us up.
Thank you, Mark. So amid all the immediate challenges caused by this global pandemic, it's important that we don't lose sight of core issues like Social Security's financial future, which is so critical to workers and retirees across the country. I'd like to extend a thanks again to Kathleen, Mark, and to Steve, Chuck, and Bob for such illuminating analysis today. I think our speakers did a really great job walking us through the latest projections and how the current economic downturn could affect Social Security's finances. Thank you as well to everyone who joined us on this webinar. If you're interested in learning more about these issues or our work, please visit bipartisanpolicy.org or fundingourfuture.us. Take care, everyone, and stay safe.